Yeah, so my name is Joakim Nordanstig, and I am an associate professor of vascular surgery at the Sahlgrenska University Hospital and the Sahlgrenska Academy in Gothenburg, Sweden. And I was the PI for the ironic study that recently presented the 5-year follow-up. Yeah, the background is really that intermittent claudication, lower limb vascular disease, is a really common health problem, and there are different treatment options, and invasive treatment by vascular surgery interventions are increasingly common, and we wanted to study the effectiveness of vascular interventions in intermittent claudication as opposed to a more conservative treatment regimen. So the design was quite pragmatic and simple. It was a randomized, controlled, open-label design, and patients were randomized either to a revascularization plus best medical treatment or best medical treatment alone. And in the best medical treatment, we also included exercise advice. The patients were patients with stable intermittent claudication for at least 6 months and with incapacitating symptoms that limited their walking ability. The primary endpoint was health-related quality of life assessed with the short form 36 questionnaire alongside the VascuQoL questionnaire. Well, both yes and no, actually, because when we estimated our study population, the primary endpoint was assessed at 2 years, and we had power to demonstrate the primary endpoint mainly at 2 years. And there we showed that the quality of life substantially increased with the strategy of revascularization. But the interesting thing in the long-term follow-up is that that early benefit was lost after 5 years. And in fact, there was also a trend that the conservative treatment, including exercise, was somewhat more efficient. And moreover, in terms of costs, the invasive strategy was almost twice as high costs associated with that regimen than as compared to the conservative treatment. Yeah, I think the main conclusion is still that revascularization for a broad population of intermittent claudication patients is of benefit for the patients in terms of improving their lives and their quality of lives, and also their walking ability up to 2 years. That is the main finding of this study. But that comes at a substantial cost for the society, and it's not a very durable treatment, as the benefit is lost after approximately beyond 2 years, I would say. Well, I think that we need to be more precise when we select patients with intermittent claudication for revascularization. We have to keep in mind that for this study, we included more or less all patients that came to us with a desire for revascularization or wanting a revascularization procedure. And obviously, there are still subgroups that benefit more than others from those procedures. And I think we need, in future studies, to target that kind of populations, subpopulations that benefit the most and have also the lowest risk for suffering any complications. I think the main take-home message is that revascularization is of benefit for patients with intermittent claudication, but the effect is not very large, and it's not very durable, and it comes with very high costs for the healthcare systems. So it might not be a treatment for everyone, but still I think that we will go on with our research and target those patients that benefit the most and still offer them revascularization in the future. This kind of studies with long-term follow-up after revascularization for intermittent claudication, it is really a scarce commodity. The vast majority of other studies have followed patients for 1 year or maximum 2 years. And I think we need more studies on the long-term durability of vascular procedures in intermittent claudication.